own Dr. Shabina Asad Qayyum, here at your service to give you another show which I hope you will find brilliant and interesting. And oh my goodness, what a day it's been, a day full of traffic, and the desperation in which I wanted to get here today, I can't tell you. So there's been lots of diversions in place in Peterborough, but I rushed to try and get to the studio to bring you the very much needed show that we all like to listen to. And I hopefully, from the feedback that I've got from a lot of you, which I'm very grateful to you about, you're finding these shows interesting and informative, and we'll be able to bring more of these type of shows to you. Sometimes we'll have guests, sometimes we won't, but we always hope that whatever we speak to you about is pertinent to the issues surrounding today's health needs of the local population, indeed of the United Kingdom mostly, and throughout the world, because we've got listeners throughout the world. How have you all been doing? I hope that you have been enjoying yourselves in your areas of work, at home and school and college and university, for those of you that listen to the show. And today I thought, why don't I was sat there the other day, I was in clinic, and it was a very busy day. I felt considerably overwhelmed with, a lot of the things that we do when we see patients. We have a lot of paperwork, we do an awful lot of prescriptions and medication reviews, and it only just gone lunchtime, and I had a splitting headache, and I was sat there thinking, goodness gracious me, it's very rare that I get a headache like this, but it then suddenly sprung to mind that I should perhaps do a show on headaches, and why not? For your information, listeners, headache is the most common ailment that patients will present to their GPs or family doctors for within the United Kingdom. So I've decided I want to talk a little bit about this today, and as usual I would enjoy your participation on text and WhatsApp on 07745 278 I've learnt that off by heart now, or you can call me on the studio telephone number on 01733 602 133. And as always, we are on Facebook Live on the Salaam radio page. Please like the Salaam radio page. It's very important we have your support. We are your local community radio station, and we are broadcasted on 106.2 FM. So let's get cracking on with this. First of all, I'd like to dedicate my show to a very special young lady who's going to be listening to my show. His name's Fatima Jawad. She looks after my children very well indeed, helps and supports them in their studies and areas of learning, and I'd really like to give her a hello and dedicate my show to her in hopes that she finds the information given in this show useful and helpful. So let's talk about headaches, and I certainly got one headache trying to get to this studio today because of the awful traffic jam in Peterborough on Burgess Boulevard, because they've got a diversion in place on the very road that the studio is situated in. So it wasn't a pleasant journey. Took some deep breaths before I got into the studio, saw Brother Qasim, the station manager, and you know what? I'm completely calm now, because talking to you all really is the highlight of my week. Talking to you, even though I can't see any of you, but I appreciate that a lot of you listen to this show, which I'm very grateful about. So, talking a little bit about headaches. Like I said earlier, headaches are very common, and many people can treat their headaches by themselves with simple painkillers, drinking extra water. I'm going to touch a little bit about headaches that are caused by not drinking enough water, having a rest, or simply by waiting the headache to go away. And a headache obviously is one of the most common reasons for attending a doctor's surgery or even a neurology clinic. So, for example, if there is a headache that doesn't go away and we're a bit baffled as GPs on how to treat it, or family doctors that see a persistent headache in an individual or a patient, we then decide to refer you to a neurologist. And indeed, headaches are the most common ailment and symptom that is seen by neurologists within the United Kingdom. And almost everyone will experience a headache at some time in their life. And I often share this story with my mother. And I usually say to her, Mum, when I was younger and you were older, and I would always listen to you saying, goodness, I've got a headache. Oh, let's take some paracetamol, or let's take some medication. And I would always wonder when I was little, I wonder what a headache's like. Oh, I'd like to have a headache to try and experience it. And I tell you, now I'm the mother of 4 kids, married, responsibilities on my shoulder. I can tell you that having a headache isn't a nice thing. So I wished for the wrong thing when I was little. But then again, when you are little, you do wish for things and you do have this inquisitiveness to try things out. But for all of you youngsters that are listening, who've never suffered from headaches before and wonder why your elders complain about suffering from a headache, please don't wish it upon yourself, because once you do start gaining the experience of having one, it's not going to be a very nice one. So that's a little tip for you, for the younger ones that are listening to me today. Most of the headaches, however, that are presented to us within a GP surgery aren't serious or don't have any sinister association with them. But people obviously worry about them, and if headaches seem different, either they're severe, out of proportion with which you can bear, or they're quite frequent, or they're unusual in any other way, the most common complaint that presents to me or that presents to other GPs is that patients present and say, well, I've got a really bad headache. It's something I can't control. They're coming on frequently, more and more. And the underlying concern that they have is that they may have a brain tumour. And in most cases, and I'm saying in most cases, that's not always the case. Now, obviously, if you're listening to my shows, I like to announce a disclaimer during my show at the beginning of the show, and that is that anything you hear from my shows in the way of treatment or advice, please, again, advice from your own GP, family physician, family doctor if you're listening abroad. And this is before you decide to embark or to try out any of the treatments that I have advised today or have spoken about today. And I don't treat anybody personally, so you're more than welcome, obviously, to phone up and ask me about anything. You don't have to just ask me about headaches. You can ask me about anything whatsoever, and I will try to help you, because that's what the Body Health and Mind show is all about. But I cannot individually treat any one patient and say, you have to take this medication or you have to take the other medication. It is something that I would like you to go to your own general practitioner or family doctor for and gain advice from them. So I hope that this sort of housekeeping rules are established in the first instance. So discussing headaches generally. So a patient's come to me, for example, and they've got headaches. I'm going to be, in this show, I want to be able to discuss the different types of headache to you. As well as the different types of headache, I want to sort of give you a bit of information about what symptoms and signs are associated with it. And along with that, I'm going to give you a little bit of advice upon what management is best available for that headache in case you have that type of headache, or what your symptoms are if you have frequent headaches and more associated with the ones that I'm going to talk about. So the other thing that I think I'd like to do is also describe to you symptoms of headaches when they are due to a sinister cause, or symptoms of a headache or any other symptoms that could be associated with a brain tumour, so that you are completely in the clear about what to suspect if you have symptoms and they are not serious, or what to expect if you have symptoms and they need further investigation, for example. So we will go through those elements. So to make it very, very easily understood, I usually like to divide headaches into 2 categories. So I say that headaches could be primary or headaches could be secondary. Why would I say headaches are secondary? I say headaches are secondary. If you have a headache that's secondary, it basically means that you have a headache that is a symptom that is part of an illness or injury. So you could have had some trauma and you'd have headache associated with that. So there's an obvious cause of the headache. In addition to that, you could have a high blood pressure and headache. So this would be a secondary headache due to an illness or a condition. And there are many reasons why people do actually come to me and say that they've got a headache, and I do check their blood pressure and find, oh, goodness gracious me, your blood pressure's quite high, I do say to my patients. So those are the basic things that we have to exclude as general practitioners, and I think it's important just to take all of that on board. Now, when I'm speaking about primary and secondary headaches, I'm going to speak about the primary causes of headaches, which are headaches in isolation. There are different types of headaches that we can speak about in isolation. And if you've just joined me on the show, this is your very own Dr. Shabina Qayyum speaking to you on the Body, Health and Mind show. And you can call in on 01733, which is the Peterborough code, 602133, or you can text and WhatsApp on 07745 278 978, or you can write a question underneath the Facebook video. I will endeavour to look at the Facebook page in the break, and thereafter I will attempt to answer some of your questions. So when we're speaking about primary headaches, your doctor can generally tell the likely cause of your headache from talking to you, from taking a history, from examining you, and once he or she or myself, we've discovered the cause of your headache, we're then able to decide how to reduce or stop your headaches. It might involve you taking medication only when you get the headache, and taking daily medication also to prevent them, or sometimes stopping medication that you're already taking, because there are some medications that can cause headaches, and we're going to go through that in a little while. So the primary headaches that I'm going to talk about are the most common causes of headaches. And the most common type of primary headache, by a long way, are those headaches that are known as tension type headaches. And I wonder what's crossing your mind when I use that word, tension type headache. You obviously think that it's going to be due to work or due to stress, for example. But let's talk a little bit about what these tension type headaches are and how they last and what their duration. So they're usually felt as a band across the forehead. And listeners, there is a really good diagram that I can give you, and I'll put it on my Body, Health and Mind page actually later on the Facebook page, of the concentration or the areas where various headaches affect you. And you will be able to understand which type of headache has pain in which area of the head. So I think that will be quite useful. And tension type headaches are characterized when you usually feel a band of pain across the forehead. So that's the front of the head. They usually last for several days, and they can be very uncomfortable and tiring. They don't usually disturb your sleep. Most people can actually carry on working with a tension type headache, and they're not usually made worse by any physical activity, although it's not unusual when you have a tension type headache to be slightly sensitive to the light or to noise at all. And sometimes I often think that I suffer from this type of headache because at the end of a very, very busy day at work, when I have lots of patients and I see possibly about 32 to 33, up to about 35 patients a day face to face. And in addition to that, you have paperwork, prescriptions, home visits, answering emergency calls, speaking on the telephone, answering queries from the receptionist. And this is just me speaking from a doctor perspective. At the end of the day, you can feel quite exhausted. And a lot of the times, a symptom associated with your fatigue is a front headache on the front of your forehead, which appears in a band-like distribution, and those are tension type headaches, and I actually do suffer from them quite a lot, but nothing that a bit of medication can't fix, which I will talk about to you now. Now, tension type headaches tend to worsen as the day goes on, and they're often mildest in the morning. Now, an exception to this would be a headache caused by sleeping in an awkward position, causing a sore neck. So if you suffer from a stiff neck when you wake up, that can also give you a tension type headache. And sometimes you can get a tension type headache due to those people that grind their teeth when they sleep, because that can often cause an aggravation of headache, which is caused by pain because of a shared nerve supply between the head and the angle of the jaw, because you have a joint in the angle of the jaw, which is your jaw joint. It's got a very long name. And because of the shared nerve supply, you can often, if you have a person who's been grinding their teeth throughout the night, they can often get a headache in the morning because of that. Now, tension type headaches are felt on both sides of the head. So if you put your hands on either side of your eyes where your temples are, they're most often in the front. They're sometimes called pressure headaches as well, and they can interrupt your concentration, but usually not bad enough to send you to bed. And most people, like I said, they work through a tension type headache if they really need to, that is, though it is off-putting and it does impair your concentration. Now, why are they actually caused? Now, tension type headaches are thought to be caused by a tightness in the muscle at the back of the neck and scalp. And anything that makes those muscles tight, for example, if you have a job that involves you sitting in front of a desk most of the time, this includes both physical and mental tension. So tiredness or having any type of stress, having any type of anxiety, and an awkward sleeping position can make them worse. Working long hours bent over a computer can trigger them, and some people get tension type headaches if they drink too much caffeine or alcohol, and a lot of us are guilty for swigging cups of coffee or mugs of coffee when we want to get through our work or try and get through our day. But actually there is some research to demonstrate that tension type headaches can often be worsened by taking caffeine or alcohol at the end of the day. And if you don't drink enough water, or if you go for a long time between meals and become tired and hungry, this can worsen your tension headache. So that's just a little bit about how and what factors can affect headaches. And it's usually when you have a tightening of the muscles of the back of the neck, what usually happens is it can sometimes compromise or lessen the blood supply that goes to the brain. And what this can then cause is a tension type headache. So how would we actually treat them? Now, tension type headaches, they are very easy to treat. So you can take some simple painkillers like paracetamol, often with a large glass of water. And I say large glass of water because you've usually heard me say this in many of the shows that I have been hosting, that having a large glass of water and hydrating yourself, fluids all the time will help you with any underlying condition you have. So maintaining your hydration is key to addressing many ailments that you may be suffering from, including tension headaches. The best approach, though, to treating tension headaches is to treat the underlying reason of it. So obviously you're able to work out what that reason is. If it's long hours at work, I obviously suggest that you could take regular breaks in between. With patients as well as doctors, we do have little 10-minute slots in between where we can get up, stretch your legs, walk around a little bit, have a chat to a colleague. And the same way, if you've got computer-based work in an office, it's always good practice to try and get up after every half an hour or so, have a good pace around, have a chat to a colleague, drink some water. I can't stress on this enough, listeners. Drink some water. And usually that gets rid of the tension type headaches. Now, it's very good to have a sensible diet. I always stress about diet as well. So changes in your lifestyle can help tension type headaches, in which you can eat regularly and have a good balance of slow release energy foods rather than lots of sugars. So reducing the number of pillows you sleep on can sometimes help, although I have to have very soft bouncy pillows and I have to have 2 pillows, so it depends. My husband has a pillow that's as thin as paper, and that helps him with his headaches, and he can't sleep without anything else. And what I would say, sleeping on your side on high pillows means that your neck is obviously bending sideways during the night, and this can trigger muscle tension and hence headaches. Other things which can improve your tension type headaches are adequate sleep and avoiding excessive noise. So these are some of the things that you can do for tension headaches, and I hope that obviously it's given you a little bit of information on that. So occasionally, tension type headaches can be caused by poor visions, especially if you're reading in the light for a long period of time. So it's always good to try and get your eyesight tested, at least on a yearly basis, if you are involved in computer-based jobs in which you're looking at the computer for very long periods of time. Now, after speaking about tension headache, there's another headache that I want to talk about just before the break, which are known as migraine headaches. And if you've just joined us, this is your very own Dr. Shabina Asif-Kiyum on the Body, Health and Mind Show on Salaam Radio 106.2 FM. Text and WhatsApp. Come on, ask me some questions on 07745 278 978 or the studio telephone number on 01733 602 133. Migraines are also very common. And a typical migraine is one-sided. You have a throbbing headache, and indeed headaches that are one-sided and throb and make you feel sick are more likely to be migraines than anything else. Sometimes there are those type of migraines that are severe enough to be disabling, and some patients do need to go off to sleep because of these headaches. Migraines are very varied in how long they last. They can last from anything from a few hours to 3 days. They're often made worse by movement or sound, which is why most patients who have these type of headaches like to shut themselves away in a room and they don't want anybody to disturb them. Some patients will often vomit, and if the pain is not severe, they can find bright light and TV can make their migraines worse. Most people who have migraines can often be at risk of developing these 1 to 2 attacks per month. So that's something to think about. Now, there are a third of people who have migraines who have something which is known as a migraine with an aura. And let me explain to you what aura actually means. It's a classical migraine. Aura means that before the onset of headache, you actually have warning signs and symptoms, and these occur just before the migraine. Now, an aura is usually seeing flashing lights, often in the shape of zigzags. They're sometimes described as looking like firework displays, and they tend to occur on one side of your vision only, although they can affect both eyes at the same time. Some people actually can lose half of their vision completely during the aura stage of a migraine headache. Other people may experience tingling or weakness on one side of the body. Some people even have this extreme that when they have migraine headaches, they can experience slurring of speech. So these are warning symptoms, and they can last up to an hour and are generally followed by a headache. Typically, the headache is on the opposite side to the visual symptoms. So if you're seeing visual symptoms in your right eye, you'll usually get the headache on your left side. What can trigger migraines? So let's talk a little bit about this. Migraines can be triggered by stress. They can be triggered by hunger. Certain foods such as chocolate and red wine, and tiredness and lack of fluid. Again, I do stress on having lots and lots of water. These can cause both tension type headaches and migraine type headaches as well. So how do we treat migraines? And also those people, before I move on, those people that tend to have migraines or headaches just before the onset of their menstrual cycle will have headaches, and those type of headaches are known as a classical headache or a classical migraine. And it's those type of patients who cannot take the combined oral contraceptive pill because it increases your chance of having a stroke. Now, treating migraines, again, migraines very much like tension headaches tend to improve with rest, sleep, darkness and keeping quiet and having a quiet environment. Drinking water can help if you don't feel sick, and simple painkillers such as paracetamol and ibuprofen can be effective. Many people find that they are not and have special migraine medication, which is often prescribed by the GP. These medications consist mainly of tablets, which you take when you have a migraine, and you take them as early as possible in the pain so that they are effective as possible. But unfortunately, these medications do not make the aura go away. Some people with frequent migraines opt to take a daily tablet which basically it helps to prevent a migraine, and these can be a good solution for those whose headaches are interrupting or interfering with their regular activities. And some side effects of these medications are that they can cause drowsiness and sleep. And if you found that useful about cluster headaches and migraines, I suggest that you stay with me, because we're going to talk about more common headaches after the break. Don't go away. This is Dr. Shabina Asad Qayyum on the Body, Health and Mind Show.
Stay tuned to Salaam Radio after this short ad break.
Sadly, millions of orphans living in the poorest countries lack the necessary support for a healthy childhood. These children have to endure lives of hardship without the basic necessities that would help them to grow, to learn, to live. Let's show them that we do care. Let's brighten up their future. Call 0161 225 0225 or visit humanappeal.org.uk.
City Homes Estate Agents are your #1 independent family-owned agency in Peterborough. We offer a range of services including buying, selling, letting, mortgages and conveyancing. Why not call us today and find out for yourself why our customers return time and time again. We have a track record for achieving some of the highest prices in and around the area for our clients. With over 10 years of operating in the area, we are the experts in this market. Put us to the test today by calling 01733 348 677 and quote discount code RADIO for our exclusive rates for this promotion. City Homes, bringing people together for over 10 years.
Feel like some great tasting chicken tonight? Great meal deals, wraps, burgers and sides. We've got it all at Chicken Palace. Call and collect at 302 Lincoln Road on 01733 702 447 or 8 Park Road on 01733 343750. Chicken Palace, open 11 a.m. till late.
Third world and developing countries are home to some of the most vulnerable children on the planet. Malnutrition, severe lack of medical aid and access to clean water are just some of the horrific challenges faced by orphans across Africa and Asia. Children of Adam, a Peterborough charity, need your help to bring aid to these orphans for just £25 a month. To sponsor an orphan or assist with other projects, please call 0300 321 0032 or visit www.childrenofadam.net.
Maha Zain is coming to Leicester with a debut tour of his latest album, One. See him perform at the Athena on Saturday the 21st of October. This inspirational tour is brought to you by Penny Appeal and Awakening Records in aid of girls' education. Buy your tickets now. Visit pennyappeal.org or call 03000 11 11 11.
Do you have lots of clutter at home or in the office that needs to be kept but nowhere to keep it? Ivet Self-Storage offers a secure, affordable, clean and dry home for your belongings. We have security systems in place which are monitored 24 hours a day, ensuring that your items are safe. With a simple monthly payment, Ivet Self-Storage provides secure and tailored facilities to meet your specific requirements, whether short or long term. We offer the best prices and longest opening hours in Peterborough. For more information, please call on 01733 306 456 or visit us at Ivet Way, Westwood.
Do you like the idea of being a radio presenter? Have you got a great idea for a show? Why not get in touch with us? We are always looking for enthusiastic, committed and professional individuals to join our team of volunteer presenters. Send us an email to info@salamradio.co.uk and we'll be in touch. You could be on air sooner than you think.
This is Salaam Radio, Peterborough's Muslim. This is Salaam Radio, Peterborough's Muslim Community Radio, broadcasting on 106.2 FM and online.
Walaikum assalam. Assalamu alaikum. Peace be upon you. Welcome back. Well, I can say walaikum assalam because, you know, I bet you would be saying salam alaikum to me for those of you listening to my show. So yes, walaikum assalam. Peace be upon you. Welcome. Welcome to the Body, Health and Mind show. It's lovely to have you. Lovely to have your company. And thank you for allowing me to keep you company. Now, as the days are getting more and more darker, we've got to make these shows a little bit worthwhile. So, your very own Dr. Shabina Kayoum on the Body, Health and Mind show is talking to you today about headaches. What a headache. Oh my goodness. One of the most common ailments that is presented to GPs, family doctors, neurologists, physicians all over the world. And if you have something to say about headaches, let's talk about it. Text and WhatsApp on 07745278978. Or you can call me on the studio telephone number on 01733 602133, and you can write any questions you want underneath the Facebook live video. So I have a question from one sister who wants to remain anonymous, who has asked me that I get migraines, which I think are on a daily basis. They are one-sided. I have taken over-the-counter medication. It doesn't seem to help. Can you advise me on what to do? Sister, thank you very much for your question indeed. My advice to you would be that there are some medications that you can take to prevent a migraine from happening in the first place, if you listen to the first part of the show. And these tablets are taken on a daily basis. There is a medication called propranolol that you can have in a little amount on a daily basis. Give that a try. There is some guidance that's been released from the National Institute of Clinical Excellence, which has some fantastic guidance for GP colleagues and for my colleagues in general, who can advise you best on what to take. And the advice is in a stepwise fashion. So if you've tried over-the-counter medication, there will be a next step. It's not specifically directed towards patients, but it's to aid health professionals. So if you were a patient that had presented to my surgery and had said that you are suffering from migraines, I would establish that by first of all asking a little bit about your history. I would then see what medication you've taken, and I would follow the NICE guidance to see what I can do to give you. And in my knowledge, it usually is giving you a small medication that you can take on a daily basis to try and prevent those migraines. So my advice to you is, if over-the-counter medication isn't helping, make an appointment to see your GP who can possibly prescribe you that medication. And obviously, if you want to take reference of this show, you're free to do so, but don't go and self-medicate yourself. That's not what I want you to do. I'd advise you to go and see your own GP first. So I hope that's helped, and I hope that that answer has been suitable for you. And moving on, we're going to be talking a little bit about cluster headaches. Now, I have personally seen somebody who has been in the midst of an attack of a cluster headache, and it is possibly one of the worst headaches that anybody could experience in their life. It is that, and also a headache that is caused by hemorrhage, which is known as a subarachnoid hemorrhage. But cluster headaches are so awfully painful that they can make grown men cry, that they're that bad. They're very, very, very severe headaches, and they're sometimes called suicide headaches. They occur in clusters, often every day for a number of days, or even can extend up to weeks. They disappear for months on end. They're very uncommon, and they tend to occur particularly in adult male smokers. They're severe one-sided headaches, usually over an eye. They're very, very disabling. They do prevent you from doing anything at all. And people often describe them as the worst pain they've ever had. And I'll tell you a story. I've got many stories to share, but I enjoy sharing these stories with you. And this was when I was a trainee GP, and I went with my trainer to a gentleman who had a cluster headache. Well, we found out it was a cluster headache because when we went in there, he was screaming at the top of his voice. And obviously I was an innocent little GP trainee, so it was quite scary watching him scream at the top of his voice, and he had clutched his head with his hands, and he literally said that he wanted to tear his head off. It was that bad. So we obviously had to give him an immediate injection of a medication. It didn't help him, and he screamed that hard that we had to actually call an ambulance. So this is just an overview, or to give you a little bit of a perspective of how these headaches can be. What can happen with these patients are that patients will have a red watery eye on the affective side. They can have a stuffy runny nose, and sometimes even a droopy eyelid as well. How do we treat these cluster headaches? They can be quite tricky to treat, but it's treatment via medication that you can take at the onset of the headache and a couple of hours later. That can make you feel drowsy. This medication, by the name of sumatriptan, can be given to you on prescription by your GP or family doctor, and sometimes there is some evidence to demonstrate that having inhaled oxygen helps these headaches. So if you have cluster headaches that last for weeks on end, then having inhaled oxygen as well can often prove to be extremely useful. Now, daily headaches, we've spoken about cluster headaches. I'm going to speak about headaches that are chronic daily headaches. I'm going to explain to you what chronic daily headaches mean. Now, chronic tension type headache is usually by muscle tension in the back of the neck and affects women more than men. Surprise, surprise. Chronic means that the condition is persistent, it's ongoing. These headaches can be started initially by neck injuries or tiredness and may be made worse by medication overuse. So I will tell you, some people have persistent headaches and they take medication. They'll take paracetamol after every 6 hours. They will take ibuprofen after every 8 hours, and they will pile on the medication. Sometimes they will take 2 or 3 medications at the same time, and this actually leads to another type of headache that is caused as a result of taking too many medications at the same time. So it's called medicine overuse headache, medication overuse headache. Now, a headache that occurs almost every day for 3 months or more, that is known as a chronic daily headache. Well, how do we treat it? How would we treat it? Or how would your physician treat it? It's best treated actually by physiotherapy, believe it or not, avoiding painkillers, and occasionally by certain antidepressant medications. And why antidepressant medications? Because research has shown that there are some antidepressant medications that are shown to be quite effective against these chronic headaches. And using painkillers regularly for chronic daily headache is likely to make things worse. So I'm going to speak about the medication overuse headache as well. And we've spoken about these chronic daily headaches, but I usually see patients who say, every single day I have a look at, I've got to work on the computer. Or I have young teenagers, for example, who come to me and they say, we've had this headache for a really long time. And the first thing I usually ask them is, how much are you on your mobile phone for? Sometimes, not in every case, the parents that attend with the teenagers or the teenagers themselves say, well, actually quite a lot. And you may have heard of something known on social media, which is known as text neck syndrome. And this is because your muscles develop into a state of spasm over a long period of time that can then hinder the blood supply to the brain and give you these chronic type of headaches. And often when I look at these patients, I look at them and I say, well, your posture's miserable because they slouch as a result of, especially growing children, looking at devices. So this is another reason why I do caution on the side of using devices. And I do think that time should definitely be limited, especially in children whose spines are developing, and not looking at electronic devices for more than 15 minutes at a time, because it can cause these chronic type headaches. We all know that, as well as affecting this eyesight, which can also give you signs and symptoms of a headache too. So please do keep that in mind, listeners. And if you have just joined me, it's your very own Dr. Shabina on the Body Health and Mind Show on. Peterborough's very own Salaam Radio 106.2 FM. So give me a call and call on the studio telephone number for anything at all if you want to, medically related, on 01733 602 133, or you can text and WhatsApp on 07745 278 978, or indeed you can write me a question on the Facebook page. I'm going to be talking now about primary stabbing headache. This is an awful lot of information, isn't it, for you to process, but it's nice that I can speak to you about it, because if a patient comes to me and says, oh, doc, I heard you speaking on the radio and you were talking about this headache and this is what I think I've got, it will help me a great deal. But this is all for your information so that you can feel reassured that not every headache is due to a brain tumour. So let's talk a little bit about primary stabbing headaches. Primary stabbing headaches are called ice pick headaches, or stabbing headaches. Now, they usually don't have a clear cause, these primary stabbing headaches. They are short stabbing headaches, very sudden, they're very severe, they usually last between 5 and 30 seconds any time of the day or night. They feel as if a sharp object, like an ice pick, is being stuck into your head. They often occur in or just behind the ear, and they can be quite frightening because people think, what on earth is happening to me? Although they're not migraines, they're more common in people who have migraines, and half of the people who experience migraine will have these primary stabbing or ice pick headaches, and they're often felt in a place on the head where the migraines tend to occur. These are very rare, but I have seen a few patients who suffer from this. Now, what would be the treatment for that? The simple answer is there is no treatment. They're too short to treat, so you can't really. There's no use. By the time you get up and do anything, the 30 seconds is over. So there's nothing that can be done to treat them, really. But preventing migraines may help prevent these primary stabbing headaches. Now, there is a very important cause of headaches, and I see lots of patients for this cause of headache. This is known as trigeminal neuralgia. Now, trigeminal neuralgia causes characteristically facial pain, and the pain consists of extremely short bursts of electric shock type sensation in the face and in the area of the eyes, of the nose, in the scalp, in the forehead, jaws, or even in the lips. And it's usually one-sided. Why is trigeminal neuralgia called trigeminal neuralgia? It's because there is a nerve known as the trigeminal nerve that has its distribution in exactly these areas of the face. The forehead, just where the nose is, and where the lips are. There are 3 branches that come out from the trigeminal nerve that can then cause trigeminal neuralgia. And it's usually one-sided, usually more common in patients over the age of 50, and it can even be triggered by cold or any other sensation or a light breeze on the face. And we would treat it with preventative medications, which are nerve pain treating medications. Now, these nerve pain treating medications are quite different from your regular ibuprofen and paracetamol. They're usually called amitriptyline, gabapentin. In very severe circumstances, we would think of pregabalin. But yes, anti-inflammatories have also been given to treat trigeminal neuralgia, such as indomethacin, which is a particular type of anti-inflammatory medication. And you also have something which is known as topiramate, which is another complex type of medication that is usually suggested by a specialist beforehand. Now, that's how you would treat trigeminal neuralgia, as well as trying to help the cause. And I have seen some patients who have been so disabled by trigeminal neuralgia that they won't open any of the windows in their house. And it can become quite unbearable for the inhabitants that are living with such individuals as well. Now, we've spoken about all of the causes of primary headaches. And if you'd like to speak or ask about any of these headaches at all, you're more than welcome to text me on WhatsApp, which is 07745278978, or feel free to call me on 01733 602 133. I will be more than happy to answer any questions you have. And if I don't get to answer your questions during the show, please be rest assured that I will answer your questions after the show. So I haven't always switched off, as they say. Now, you'll remember at the beginning of the show, listeners, that I spoke to you about a cause of headache, which is known as secondary headache. And some people have underlying causes, if you remember what I said to you, and some of these underlying causes or conditions or diseases can then cause headache as part of their symptoms. And treating that headache involves treating the cause. And like I said, that some people worry that these headaches could be due to a brain tumour, but high blood pressure sometimes can cause no symptoms at all, but sometimes it can cause headaches and dizziness. So the other causes of secondary headache are chemicals, drugs, and obviously withdrawing from substances. So, for example, carbon monoxide. If you don't have any gas checks within your home and you're leaking gas, which can also be caused by gas heaters which aren't properly ventilated, by drinking alcohol, with headache is usually experienced the morning after, which people usually call a hangover. If you are dehydrated, again, we're coming back to drinking. Drink as much as you can. Having enough water is good for anything from headaches to constipation, to feeling healthy, to feeling energetic, to preventing infections of the urine, you name it. Water will have a place in helping that condition. Medication-induced headache that we spoke about earlier, or having too much headache in the attempt to treat a headache, can often give you a headache due to too much medication. Sounds strange, doesn't it? But it actually does happen. Now, medication-inducing headache is very unpleasant, and it's a long-lasting headache, and it's caused by taking pain-killing medication. Now, when painkillers are taken regularly for headache, the body actually responds by making more pain sensors in the head. Isn't that bizarre? And eventually the pain sensors become so many that the head becomes super sensitive and headaches actually don't go away. People who have these headaches often take more and more painkillers to try and feel better. However, the painkillers have often stopped working a long time ago. So what would we do to treat these medication-induced headaches? Unfortunately, the treatment is to stop all painkillers for at least a month. And it's horrible because you'd have to put up with symptoms of a headache for at least a month if you come in this category. And most patients find this very hard to do. And they do need to have a lot of convincing to try, as this means living with the headaches without treatments. Now, I'm being very open and transparent here, listeners, but these headaches can sometimes take weeks or even months to lessen, so you do need a lot of willpower to try and get through them, and they may get worse first. They don't usually completely stop you from doing any activity, but the constant nature of the headache can be very, very wearing and very tiring indeed, and people usually find it very difficult to function. And understanding that you have been taking very regular painkillers, but they really haven't solved the problem, is the first step in recognizing that you actually may have this type of headache as well. So what we've got to do is that we've got to try and stop all types of painkillers in this. Now, sinusitis can also be a common cause of secondary headache as well, and this is more described when you're bending forwards and you feel pressure in your head increasing, especially within the forehead region, and the treatment for that would be to try actually to give you antibiotics, or sometimes in extreme circumstances where you have had sinusitis for a long time, an operation. And glaucoma, which is when the pressure increases within the eye socket or the eyeball because of a buildup of fluid within the eye, and it can deteriorate vision, can also give headaches, which are of a secondary cause. And the treatment would be to see an eye surgeon and to try and get the glaucoma fixed, which is usually by giving eye drops. And you can get exertional headaches, such as when you have intimate relations with your partner, and that can be the onset of headaches. But do be wary of these headaches, because if they are very severe, they could be a sign that you're having a little bit of a bleed, especially when you have intimate relations with your partner. So that could be one cause for your headache as well, to exclude a bleed. There are some people that have headaches because when they strain with their bowel movements too, but it's very, very uncommon, so we really don't need to speak in too much detail about that. Now, dangerous headaches we're going to talk about in the last couple of minutes, because this is where I need to make you aware of what the signs and symptoms are of these headaches so that you can go to a medical practitioner or your GP. All of your headaches are unpleasant. We all know they're unpleasant, but we know which ones are the primary headaches and that can be treated. Dangerous headaches, they tend to occur suddenly, they become progressively worse over time, and they're more common in older people. And they can include the following: bleeding around the brain, which is known as a subarachnoid hemorrhage. And a subarachnoid hemorrhage is a very serious condition, and you have a very high death rate with this. And it is caused by a small blood vessel which bursts on the surface of the brain. They develop a very severe headache and a stiff neck and become unconscious very quickly. And it's a very rare cause of severe headache, but if somebody describes a headache that is sort of a thunderclap, as if the thunder has broken within their head and they have neck stiffness, you are to call 999 immediately, especially if they have deteriorating consciousness. Meningitis can cause headache, but meningitis can also cause a stiff neck, and you would also have symptoms of temperature with it. People will become sick, they can't bear bright light, and they can't touch their chin on their chest when they have this type of headache associated with meningitis as well. There is a type of headache that is known as temporal arteritis, in which usually happens over the age of 50 in some people. It's caused by swelling or inflammation of the arteries in the side of the head, and usually such people find it very, very difficult to comb their hair. Their head would feel tender, and sometimes they have visual symptoms in one eye or the other. Treatment is obviously with a course of steroids, but you need to see your GP or your family physician for that. Let's talk about brain tumours. Now, brain tumour, first of all, I'd like to establish, is a very uncommon cause of headaches, although most patients with long-lasting, severe or persistent headaches then start to worry that this is actually the cause. But brain tumours can cause headaches, but usually the headache of brain tumours is present on waking up early in the morning. It's worse on sitting up, and it gets steadily worse from day to day, never easing, never disappearing, and it can sometimes be worse on coughing and sneezing. But that's also the case with sinus headaches and migraines as well. When should you actually worry about a headache? Now, healthcare professionals are trained to ask you particular questions. So we've got to see if your headache would be serious or sinister. So some of the things that would be asked are if you've had any significant head injury over the previous 3 months, if your headaches are worsened and accompanied by a high temperature, if your headaches have started extremely suddenly, if you've developed problems with speech and balance as well as your headache, if you've developed problems with your memory or changes in your behaviour or personality, if you're confused or if you're muddled with your headache, if your headaches have started when you cough, sneeze or strained, your headaches worse when you sit or stand, and your headaches are nothing like you've ever experienced before. And if you have low immunity, for example, if somebody has HIV or are on steroid medication or immune suppressing drugs, if they've got underlying cancers, because obviously there is a risk to spread to the brain as well. And in summary, because most headaches are unpleasant, they're harmless and respond to simple measures like migraine headaches and tension headaches. These are all very common types of headache, but the sinister headaches are very, very uncommon indeed. And they are rarely a sign of sinister illness. So if you've got a headache that's unusual for you, discuss it with your doctor. And also, especially if you're over 50 years of age and you never usually used to have a headache. Now, I'm going to give you some tips at the end before we close up. And remember that headaches are less likely to occur in those who manage their stress levels well, eat a balanced and regular diet, take balanced regular exercise, Pay attention to your posture. So I see many teenagers and I say, look, first of all, your posture is very sloppy. So straighten that back, lift that head up, lift that chin up. Feel proud about going out into the world. You are teenagers and you have your whole life ahead of you. So look as if you have your whole life ahead of you as well. Sleep on 2 pillows or fewer. Drink plenty of water. Have plenty of sleep. Take your kids off their electronic devices by 9 o'clock and make sure that they don't have them. And anything that you can do to improve any of these areas of your life will improve your health and well-being and reduce the number of headaches you experience. So listeners, that was my show for today. And if you have any questions whatsoever, I'd be more than happy to answer. This is just to remind you that Penny Appeal, the presenters will be running on behalf of Penny Appeal in the Great Eastern Run, which is dated the 8th of October 2017 on a Sunday in Peterborough. Some of us are going to be doing the fun run, others will be doing the marathon. The Salaam Radio Facebook page has the link, a Just Giving page that will take you to sponsoring us for this very noble cause. And the money that goes to the Penny Appeal charity will contribute to building homes for orphans. And what a wonderful cause that is. And as always, I bid you farewell. I'm sad to go, but I'll be seeing you next week for a very special show with a consultant pediatrician. So don't miss the show. This is your very own Dr. Shabina Asad Qayyum for the Body Health and Mind Show on Salaam Radio.